Hello, this is Dr. Tay, and today I will be talking about the basics of breath work and more importantly about Wim Hof breathing or the Wim Hof method and cold exposure and what the science is on. And the goal is that this breath work teaches people to modulate their stress response, dampen inflammation, reduce mucus buildup, and strengthen the immunity. And let's see. Here we go. This is what I just talked about. And and there I am. Yes. All right. So, um, this is me and a couple of buddies getting together at my office, and I teach the breath work. I do a little presentation about the science, and then we do the breath work for about 40 minutes, and then we go outside in the parking lot and we dump about 200 to 300 pounds of ice, and we take turns going into it. And so far, no one died. I guess we did it correctly. I got one person that got sick from it. So I'm trying to make sure that people don't get sick, but it does happen from time to time. And this is Mr. Wim Hof, the guy who popularized breathing. And now there are all these biohackers who are trying to become superhuman. And it's a great way to um, do this type of breath work that really enhances your health. Some of the achievements that Mr. Wim Hof did was that he was able to climb Mount Everest in 2007 wearing nothing but shorts and shoes and did not die from hypothermia. People wear like Arctic gear just to go up to the mountain. And the cool thing about Mr. Wim Hof's method is that his breathing technique mimics high altitude training, and therefore they don't need to adjust to the different zones uh, for climbing to the Mount Everest. He can just do that, and he was able to demonstrate that with his people who practice the Wim Hof method, not only at Mount Everest but also at Kilimanjaro. He ran full marathons in the polar circle in Finland, also in the desert. He was able to take the longest ice bath, which was close to about 2 hours. And years later, not too long ago, other people have broke his record. And he also swam in underneath ice for over 200 feet without having to die from hypothermia. And if you watch the video, he'll tell you the story. It was so cold in there that his eyes shut and he got lost. And the camera guy kind of like showed him because he saw what was happening to him. So he put himself really in harm's way to demonstrate that, doing this type of breath work and continuing to do the cold exposure, you can become superhuman. And what he stresses is that time and time again that he isn't special, that he's not superhuman, and that anybody practicing his method can do this. And he has demonstrated that time and time again. And his method is three things. Commitment, that's the mindset. You stay committed to this method. Two, the commitment means that you're kind of doing the breath work and the cold exposure on a consistent basis. Now, more importantly, I will emphasize doing the breath work because it has other health benefits that I teach in my office to my patients. And we'll talk about that in more future videos. The Wim Hof method was designed so that it can make the average person to do more. And if you're an athlete, get your peak performance out. And you can, if you stay committed to do it, it will enhance your health by a lot. And about the immune system is that in 2013, he trained 12 people in just 4 days. And when they were injected with endotoxins, which is the protein in the virus, that when you put it into your body won't get sick. However, you will develop a fever because it has a immune response to it. And people practicing this did not get a fever. And then studies later, when the same people, when they don't do the breath work, they will develop the fever. And they get as other people who never tried it and do the breathing technique, it will they won't produce the fever. So it's proven that this does increases your immune system by a lot. And the people who have benefited from this technique is MS, Parkinson's, asthma, anxiety, depression, autoimmune conditions of all kinds, including rheumatoid arthritis. And one of the things that I use to help treat is most importantly is sleep apnea. And the way it works is that when you breathe into your maximum capacity, as AKA the way Wim Hof teaches is fully breathing in and let go. Fully in and let go. Now, if you're watching this video, I recommend not practicing while you're operating a motor vehicle, when you're sitting or standing. I would prefer that you do this while you're laying down. For the being that 15% of the population will pass out. And if you pass out while you're driving, you will hurt others, and more importantly, you will hurt yourself. Plus, you'll get into a car accident. And if you're standing doing this, and if you fall, you'll have a concussion. Same thing if you're sitting. So I would prefer people practicing this laying down for their first time. And the more you practice to breath work, you'll get used to the breath work where you don't get so lightheaded. So don't practice this while you're watching this. Okay, I'm just demonstrating. So when you take deep breaths and let go, I modify it where that people for the first time is that they're breathing out longer. Reason being is that when you do a push-up and when you're slowly coming down, you're building more muscles as you're coming down when compared to when you're doing a push up. And what this allows your body to do is when you're breathing out slower, you're building more muscles of respiration. Now, people ask me, should I breathe in through my nose or my mouth? I always tell them breathing out through the nose is the best, but Wim Hof teaches where you breathe in through your nose and breathe out through your mouth. Okay? If you can, I always tell people breathe in through your nose, slowly breathe out through your nose. And after doing this for about 30 times, you can hold your breath after the exhale. And then you'll feel your neck muscles pulse twice, indicating that you have to breathe. If you can hold it a little bit longer, it's even better. And then when you do breathe into your maximum capacity. And hold your breath at the apex and count to 15 seconds. This is considered round 1. If you could do 3 rounds, and if you take your time to do this, it's about 45 minutes. If you do it faster, you could do it in about 12 minutes, the whole thing. So it depends on how you do it. And I've taught this breathing technique to several people with sleep apnea, and they were able to, and after about 3 months, they were breathing a lot better through their sinuses. And more importantly, they built muscles of respiration. And I think I have nose strips. Hold on for 1 second. Ta-da! This is a company that I just bought for the first time, and a lot of people with sleep apnea, I recommend doing this, and also mouth taping. There's a great book by James Nestor that you can purchase about breath, and he talks about how he had sleep apnea and he had brain fog and he had very chronic fatigue, and he fixed it through mouth taping. Now, will that fix everybody's? No, not necessarily, but it's worth giving it a try. So, Wim Hof breathing uses a form of intensified fast breathing, and the CO2, like I said before, it alkalizes your body, and you're controlling hyperventilation, or what they call intermittent hypoxia when you're doing the breath holds, and your body responds by creating stress responses, and your body go into a minor state of fight or flight, which produces cortisol and adrenaline, and the focus to mitigate the inflammation in the body. There are a lot of scientific data about this, about how the cytokines gets released for autoimmune diseases and involuntary activation of the sympathetic nervous system and attenuation of the innate immune system response. So there are other things that you can really look into, how this affects into your immune system, which I'm not going to go into great detail. But until next time, I'll see you. Bye.